Hi, my name's Kirsten. I went to Ryerson University in the Midwifery Health Sciences program for 3 years, and then I had the fantastic opportunity to go to Uganda on a health internship. Uganda is surrounded by Kenya, Tanzania, and the Sudan, and Rwanda. It's also called the Pearl of Africa. I landed in Entebbe Airport, and then I took the hour drive to Kampala, which is the capital city. Has lots of grocery stores and malls. It's a big city center, lots of business buildings. If you take a 3-hour taxi ride, a very crowded taxi ride, on Mbara Road, you'll get to a small rural village known as Cheteme. In Cheteme is the Uganda Rural Fund, where I did my internship as a health and women's empowerment intern for 4 months. Because of my health background, I had the amazing opportunity to do different medical camps in the 6 surrounding villages, a 2-day midwifery workshop with the local village health workers. I really got to meet everybody and learn about different community mobilization and different events going on. I had a couple textbooks with me. I think it was Penny Simpkins' The Birth Partner and the SOGC Guidelines to Midwifery and Obstetrical Care. And when I was there, I saw a lot of things, and I realized that I wouldn't be happy being a midwife for the next 20 years of my life. It hurt my soul a lot to see some things that were going on, and I wanted to come at it from a different perspective. So I've chosen to do international relations and not finish my midwifery degree. So I had these textbooks left over. So I thought, well, I'm here, I should do something good with them. So I went to the Cheteme Nursing and Midwifery School. It's a new university that is trying to open up. They have all the infrastructure in place. They have staff, they have buildings, they have student dormitories, they have a library. They have everything to open the school, except legally, they can't open the university until they have all the required textbooks. They've been trying to fundraise and buy these textbooks from the UK, but each textbook costs £800. Now this isn't Ugandan shillings, this is English pounds, and it's really incredibly difficult to raise that kind of money. When the average person makes $1 a day, how are they going to raise that much money? So I donated my textbooks, and I realized I knew a lot of other midwifery students that I'm sure would want to donate textbooks or maybe donate some money so that we can get the school open. If all they need is books to train local women and men to become nurses and midwives and empower the community and create sustainable health care, we can send over some books. So I've started a website called Medical Text Uganda, and on that page you can donate and you can see the village of Cheteme, you can see different pictures I took. You can see the school, and I'm hoping that I'm going to get some support from the midwifery community, whether it's students or working professionals, nurses, anybody who's interested, anybody in the healthcare field, because I think it's great when we can go over for 4 months and do an internship, but you can't really ask people to keep coming over, to give up a year of their life or 4 months of their life to work someplace. It's much better for everyone else in the village if you can create sustainable healthcare, train people that are going to stay in the village and look after everyone. And this university is going to mean so much for a lot of people because, it costs 5,000 shillings to get to a hospital in Uganda if you have a healthcare problem. And if you can afford that 5,000 shillings, which is a lot of money, about $2.50 Canadian, then you have to pay for your medical fees, and then you have to pay for all your food and your accommodation at the hospital, which is completely out of the reach of people. So you get people who are blind because they can't afford glasses, you get women who have had an abortion and because of unsanitary conditions now have a giant raging infection that could kill them and they can't afford to go to the hospital. You have children with polio that can't afford health care. If we can get these textbooks and open up these schools, these people won't have to go to Masaka to go to the hospital. They can receive healthcare in their own community. So I'm really hoping that you can support me in this. Please look at my website, again, Medical Text Uganda, and hopefully I will update you with more videos and news about how this project is going. Thank you.